I'm Judye Hess, and I am a family and couple therapist, and I've been doing this work for 40 years, and both practicing with families and teaching classes in uh, both couple counseling and family dynamics and therapy at California Institute of Integral Studies in San Francisco and several other graduate psychology programs here in the Bay Area. But today I am here to talk about doing family therapy with adult children. And what that means is that instead of working with the family unit that's living together, the adult children are no longer living at home, and they may be having their own families. They may not even live in the area, but the point is that they have different kinds of issues than just regular family therapy, which are more like behavior problems. So when people have an estrangement between themselves and their parents or siblings, it's very painful. This is could be a family that used to be very close, but then as the adult child moved into adulthood, they changed their mind about how they want to relate to the parents. So they might be mad about the parent criticizing them for their choice of relationship, their career, their sexual orientation, anything that might elicit a critical response, judgmental response from the parents. And the adult child nowadays has the ability to go out and make it on their own in the world, and sometimes they do that, but there's still these unresolved feelings between the parents and the children, that something just doesn't feel right and completed. So a lot of times the people that come to family therapy, uh, this kind of family therapy, could be initiated by the parents, who are usually very unhappy that they're not able to connect the way they want to with their kids and maybe their grandkids. And so a lot of animosity, hard feelings can come up when that's happening. So the parents might want to initiate the therapy. On the other hand, it might easily be the adult child. As the parents are getting older, they may start to feel, I better take this chance and work some things out with them before they're not around anymore. And so that is often the motivation that these children and parents have for taking the risk of coming to a family therapy session and talking about their feelings towards each other, their feelings about themselves. And it's a very emotionally intense experience, but it's one way that things that were unresolved in the past can become resolved. If they have a safe environment where they feel free to express themselves, both the kind feelings that they might have towards each other, the loving feelings, or some of the negative feelings where they felt unheard, unseen, and those feelings could go back to being 3 years old. That still is ruminating in the child's mind, and they just feel like they want to work this out. So that because sometimes it's interfering with their own relationships. So another reason for people choosing this method of therapy is that uh, what is called failure to thrive, and this is a situation where the the child, the adult child, is still living at home, hasn't really moved to get their career going, is being supported by the parents, and still not communicate. They may be living in the basement and they have their own door and they just take care of themselves, but they're still living there. Now, the parents often want to put their foot down, but they are afraid that the child is going to wind up on the street. Maybe the child already has a drug problem or some emotional difficulties, and the parents, they might be angry that the child is still there and not really connecting with them, but they also love their child. Uh, they don't want to withdraw their support. And then when they're also giving the child money to live on, then it becomes even more of a problem, because they feel the child feels obligated, the parents feel like they're being used. We're giving you all this money, a place to stay, and you still won't talk to us. So again, if we get them in a situation where they feel safe and they can express themselves, um, miracles happen. It's not exactly a miracle because that people are learning how to speak to each other, but sometimes it can go very quickly. One session, 3 sessions, and enough things get said. Uh, Also, it could be siblings that want to come in after the parent has died. Maybe they left a will or a trust for one of the kids that is more than or less than the other kids. And so the kids will come in to talk about their anger or resentment towards each other for maybe they feel like that child was the favorite one all along, and now the proof is that they're getting more of the money. So all these things are can be very challenging, and if people knew that this was available as a method to go to where things could actually get cleared up, then why not, right? It's not always that easy. Sometimes only one parent wants to show up or one child. So you have to work to get them all to participate. But once you do, it's very valuable, and it changes their relationships for the long haul. And then the parents could maybe see the grandchildren, which is what they really want, and then things can move along in a much smoother way. Perhaps the failure to launch becomes something more turning into a career that the child really loves. And so we're not saying that failure to thrive is going to be the person's situation forever, because that's the hope, that they can, whatever is keeping them in the house and away from their peers is going to be an uncomfortable situation. Okay, so one other thing is cultural competence, because different nationalities, ethnicities may have very different views of uh, the parent and or the parent-child relationship. So we have to pay attention to that right off the bat, and not be pressuring them to do something that is against their lifestyle that they've had for years and years. So that is another thing to keep in mind. That's going to be it for today, and I hope that you've learned something. And if you're either the adult child or the parent or the sibling, please feel free to visit my website, which is judyhess.com, and we can set up a time to talk and see if this method would be helpful in this particular case. Thank you.